Well, good morning. Good morning. This is Dr. Yonnette with another episode of Baby Talk. I almost wanted to say good morning, my fellow Americans. I feel a little, what's the word I'm looking for? A little political. Yes, feeling a little political. But this morning I am so excited to be able to talk with you again on another topic that relates to parenting and caring for your infant, your baby, your toddler, your preschooler, whatever age your child is. And I was reading on my Facebook page a parent who was talking about her baby after a C-section. So today we are going to talk briefly about caring for your baby born by C-section. And you know what a C-section is. It's where the baby is birthed through a cut in the belly, so that process, the baby does not go through the birth canal for that birthing period. So let's talk about what happens when you deliver your baby through C-section. You know, when your baby is delivered through C-section, your baby has is exposed, or I should say has the there's a possibility that your baby would have some drawbacks. Your baby may cough up. One of the drawbacks is that your baby may cough up mucus in the first few days after your C-section. And when a baby is birthed through the birth canal, the mucus is usually pushed out of the baby's lungs as he is going through, or she is going through, the vagina, the vaginal delivery. But this doesn't happen during a C-section, because all you're doing is just pulling the baby out, and there's nothing to squeeze the baby so that the lungs bring out, release that mucus. So the mucus after the baby is born through C-section can make it harder for your baby to feed and to sleep, and so it can become worrisome. But how do you handle the baby in these few days after birth? How do you work with your baby to help him or her get through this period of congestion? Now let's talk about a little bit about what causes the congestion in your baby. We just went through that. But we want to talk about the remedies. What are some of the home approved remedies that the doctor would be okay with you doing after you take your baby home and your baby is congested? And this information, the remedies, are coming to you from the baby. This is coming to you. Let's see what our reference is. Our reference here is this is by Schwarzman. This article is by Schwarzman, and I'm sharing information on what she says. Now, we talked about the congestion. Most of the times the congestion is caused by the baby in infants is not from bacteria or viruses, I should say. But what you need to know is that using breast milk, I'm going back to breast milk, the number one thing. Breast milk is one of the most natural ways that you can help your baby to get through that congestion. And this article is recommending that you take a drop or two of breast milk and drop it in the nose, and this would help to loosen up congestion. And then you let the baby sniff it up, then give baby tummy time if he or she is able or old enough to hold his head up during tummy time, or you can hold the baby upright over your shoulder, and that would help drain the congestion. from your baby's nose. You can use nasal saline, but remember your nasal saline should not have any medication in it, because at this point your baby is too young to deal with some of the medications that are on the shelf. As the breast milk, you can also add a drop or two of the breast milk in the saline as you are using it. So you wanna buy nasal saline, make it, or you can make it at home. And to do that, you mix a quarter teaspoon of table salt and 8 ounces of bottled water to make that nasal saline. You can also use a cool mist humidifier. You want to fill up the humidifier with plain water, no Vicks or any other substances, and run it in the baby's room while he or she is sleeping. Put it close enough to the crib that it really makes a difference. Then you can do a steam room. Steam up the bathroom and sit baby on your lap, or while you're breastfeeding, you can breastfeed the baby in the bathroom for about 20 minutes, and so that humidity will loosen up the congestion in the nose and help to drain the nose. You can also use a nasal aspirator. Instead of loosening up the mucus, aspirators will remove it. So it helps to apply saline or breast milk drops into the nose first, and then any dried out mucus would be easily removed. So you already have the bulb that you use for your baby. I'm sure you left the hospital with one of those, and you can use that to help clear the nasal passage. Now, if your baby is old enough, like 6 months old and up, you can use warm juice. Warm juices will help your baby to get rid of the congestion in the nose. And you want to make sure that warm, unsweetened apple juice or warm water should be used. You test it on the inner wrist to make sure it's not too hot, so that you can give the baby and baby wouldn't get hurt. Then if your baby again is old enough, you want to use you can use chamomile tea. Oh boy. And this is another throat soother for older babies. Your baby has to be older. But don't add honey to the tea. Just give him that tea in water, bottled water, and that should be able to help your child. So newborn babies are such a pleasure to welcome into the family, but sometimes they come with some difficulties that we as moms struggle to get through with. And one of these difficulties is the nasal congestion or the general congestion that your child may have, that I'm talking about this morning. You want to try to also include your child's pediatrician. Include your child's pediatrician if your child is struggling, but it's only if your child is struggling with breathing and sleeping and feeding, then you need to get to the point where you are consulting with your pediatrician. But those home remedies that I mentioned just a minute ago should help. And if your child was C-sectioned, in about 3 to 5 days, you should see some relief coming to your child. I know it's an anxious period when you are with a newborn and you are trying to make sure that he or she survives and thrives. So take care of your baby, take care of you, and have a great day.